When it's a younger population, say coming with um, small ovarian cyst or a small uterine mass, I would not worry about it so much. We would carry out the test required, and if it is something which can be treated with hormonal treatment like an ovarian cyst, then we would try and first treat it with medical treatment itself rather than subjecting a young girl to surgical therapy.
Right.
Similar is the breast lumps. In the younger age group, they are most often benign. They are fat lumps. So unless they are cosmetically bad, they are of a certain size or to just be, but just be there. There is no medical treatment for a breast lump as such.
Right.
So that is regarding a younger age group population. Most
Right.
often the problems are between 30 to 50. That's the population which is undergoing something called as perimenopause to menopause change. So they are in the
Right.
reproductive age group, then they are having hormonal imbalances towards the end of their reproductive life, and then they enter into menopause. So this transition is the time when most of these women are going to come back with problems. This transition time is the time when they are going to come with ovarian masses, they are going to come with cervical problems because the infections they have acquired in a younger age group when they were active sexually. That's when the infection occurred on the cervix, and the result will be seen about say 15, 20 years down the line. So many of them will come to us with malignancies towards their 50s and 60s when it comes to cervix. When it comes to breast lumps, more and more number of cases we are seeing in the 40s and 50s, especially in the urban centers like Mumbai, with breast cancer. So no lump in this age group goes unchecked or unbiopsied. Now, when it comes to menopause, anything which is growing, that's the rule of the thumb. Anything which is growing, which should not be growing, is to be worried about. Whether it's the lining, whether it's the ovarian size, whether it's a breast lump, anything of that sort has to be looked into. So that is when we come and we try to interfere. We do investigations. Sometimes they feel that this was investigation was not necessary. Maybe we have done a sonography, it shows something to confirm. We do a CT or an MRI, and then it shows that no, the probability is far less, and we can avoid a biopsy or we can avoid an active intervention like surgery. That's when we inform the patients that that is probably not required. A close observation would be sufficient. But even if it looks unnecessary to you, probably just to increase your safety margin, the doctor had ordered it. So these are cases in which something is out of the way, then that has to be investigated.